A very good afternoon, everyone. Um, Welcome to today's live session. I'm Dr. Radhika, Clinical Head Fertility Specialist, Oasis Fertility Vizag branch. So, Facebook live session lo manam discuss cheskoboye topic advanced age and fertility options. So, advanced age unde వాళ్ళకి fertility treatments కి వెళ్తే ఏం ఆప్షన్స్ ఉంటాయి, వాళ్ళకి మనం ఏ విధంగా ట్రీట్ చేయాలి, ఒకవేళ అడ్వాన్స్ ఏజ్ వాళ్ళు ఫర్టిలిటీ ట్రీట్మెంట్ కి వెళ్తే వాళ్ళకు ఉండే సమస్యలు ఏంటి, లేటర్ ఆన్ బేబీకి వచ్చే ప్రాబ్లమ్స్ ఏంటి, ఏ విధంగా మనం దాన్ని ట్యాకిల్ చేయొచ్చు అనేది ఒక స్మాల్ జస్ట్ ఐఎమ్ గోయింగ్ టు టాక్ టుడే. So first of all, talking about advanced age, why are we talking about age? Usually chala mandi, if you're less than 30 years and you've been trying for more than 1 year, naturally try చేస్తూ pregnancy రాకపోతే, then you'll have to meet a fertility specialist. But ఇది same 1 year time period అనేది అందరికి అన్ని ఏజ్ గ్రూప్ వాళ్ళకి సేమ్ గా ఉండదు. See, if maybe you are more than 35 years old, 1 year వరకు వెయిట్ చేయకుండా ఇంకా తొందరగా లైక్ లెస్ దెన్ 6 months or అట్లీస్ట్ 6 months వరకు మీరు న్యాచురల్ గా ట్రై చేసి 6 months తర్వాత కూడా మీకు ప్రెగ్నెన్సీ కలగకపోతే, if you are more than 35, then you have to meet a fertility specialist. So why are we telling this only 6 months after 37 or 35 years old? And because after 35 or 37 years, usually there will be a drastic decrease in the egg numbers and the egg qualities. Chala mandi, if somebody, most of them like rare ga chala mandi, 40 years appudu kuda late marriages cheskoni 40 years appudu kuda pregnancy kosam try chestuntaru. So atlanti vallu, when they get married at that age, వాళ్ళు మళ్ళీ 1 year 2 years వరకు వెయిట్ చేసి టైం న్యాచురల్ గా ట్రై చేస్తూ టైం వేస్ట్ చేయకుండా, when they get married in a very later age, definitely they have to meet a fertility specialist early, because మనం ఏం చూడాలి, ఒకవేళ వాళ్ళు మన దగ్గరకు వస్తే ఫస్ట్ మనం చూడాల్సింది ఏంటి, స్కాన్ చేసి ఒకటి మెయిన్ థింగ్ వాట్ వీ హ్యావ్ టు డూ ఇస్ వీ హ్యావ్ టు చెక్ దేర్ ఓవేరియన్ రిజర్వ్. సో ఓవేరియన్ రిజర్వ్ అంటే ఏంటి, ఓవరీస్ లో సర్టన్ ఫాలికల్స్ అని ఉంటాయి, సర్టన్ నెంబర్ ఆఫ్ ఫాలికల్స్ ఫర్ ద ఏజ్ గ్రూప్, డిఫరెంట్ ఏజ్ గ్రూప్. Usually normal ga 8 and 8 AFC is a normal AFC which we're looking at for a normal reserve patient. But if they are 40-year-old or if they are more than 37-year-old, we have to check nijanga vilki the reserve unda, inka manki time unda, how much time we have, because after 37 there will be a drastic decrease. See, if you have only 1 or 2 follicles or only 2 or 3 follicles, definitely the chances of getting pregnancy or getting a natural pregnancy is very, very less. So alanti vallu తొందరగా ట్రీట్మెంట్ కి వెళ్ళి ఎగ్ ప్రిజర్వేషన్ అన్న చేయించుకునేది అనేది మనకి డిస్కస్ చేసుకుందాం. ఇప్పుడు వన్ మోర్ థింగ్ ఇస్, ఇఫ్ somebody who is 37 or 35, they come to me and they planning for pregnancy, they're married for only like 4 years or 5 years or something, and they come for pregnancy at 37 or 38 years. First thing what we should see, first of all, we should see whether her BMI is good. Does she have any medical conditions? Because 37 above 40 years unde valki, we have to look into other medical conditions also. Valki BP undachu, sugar undachu, thyroid undachu, even cardiac problems kuda undachu. 40 above వాళ్ళు ఎవరైనా ప్రెగ్నెన్సీ కోసం ట్రై చేస్తే డెఫినెట్లీ వాళ్ళ కార్డియాక్ ఇవాల్యుయేషన్ కూడా మనం చేయాలి. దాంతో పాటు వీ హ్యావ్ టు హ్యావ్ అ ఫిజిషియన్ కన్సల్టేషన్. సో 40 years తర్వాత వాళ్ళు ప్రెగ్నెన్సీ క్యారీ చేస్తున్నప్పుడు వాళ్ళకి ప్రెగ్నెన్సీలో కూడా, వెన్ దే ఆర్ ప్రెగ్నెంట్ ఆల్సో, అలాంటి టైంలో కూడా వాళ్ళకి బీపీ అండ్ షుగర్ వచ్చే ఛాన్స్ ఎక్కువగా ఉంటాయి. And plus cardiac problems kuda manam miss kaakunda, we should get a fitness from the physician and then only plan pregnancy if they're 40 and above. Say if they're 37 or 35 above, first of all what we should check is their ovarian reserve. We have to do their blood test when they come to us on day 2 or day 3 of your period, and then we will see her hormones. Day 2 of period lo FSH, LH, E2 ane blood test cheskoni ade roju scan kuda cheskoni ovarian reserve ela undo manam chudali. Say 37 years old, she's recently married, she's not tried anything, she's recently married and she's come to us and her reserve is around 5 or 6, and it is an average reserve, so not very less. Atlanti vallu, they can try IUI or simpler treatments, but after 37 above age group, even IUIs try chesna kuda chances of pregnancy with an IUI is very, very less. Normally IUIs for normal age people or normal reserve people will be around 10 to 20%. But if a 37-year-old goes for an IUI, the chance would be only around 5 to 10%. So that also they should understand. They're okay with that percentage, yes, they can try only for 1 or 2 cycles of IUI, maximum of 3 if their reserve is good and also the sperm factor is good. Husband's side నుంచి sperm anta బాగుంది, ovarian reserve baane undi, even at that age అనుకునే వాళ్ళు మట్టుకి they can try for at least 2 or 3 cycles of IUI. But more than 37 age or more than 40 age వాళ్ళకి, one more thing what we should see is, their chances of aneuploidy. So age advance అవడంతో పాటు వాళ్ళకి egg reserve తగ్గుతుంది, egg quality అనేది తగ్గుతుంది. And one more thing is aneuploidy rate అంటే abnormal గా ఫామ్ అయ్యే embryo. So egg and sperm రెండు కలిసిన తర్వాత ఫామ్ అయ్యే embryo that will be abnormal. So most of them above 37 or 38 they are more prone for abortions. Pregnancy chances కొంచెం తక్కువగా ఉండొచ్చు, percentage of getting a pregnancy will be less, and also getting a live birth rate is little less. So definitely we have to screen the embryos also. People say a normal age, less than 35-year-old lady is going for a pregnancy. They're going for an IVF treatment. Say if they've got 10 eggs and they've got at least like 3 or 4 blastocysts. Atlanti వాళ్ళకి probably 1 or 2 will be abnormal and మిగతా అన్ని embryos or మిగతా అన్ని eggs. Say if they get 10 eggs, వాళ్ళలో 6 to 7 eggs normal గా euploid eggs ఉండొచ్చు. But in the same case, if a 37-year-old or 40-year-old is going for a pregnancy and they've got the same number of 10 eggs, వాళ్ళలో probably only 3 or 4 or 5 eggs would be normal. The other five of them would be abnormal. So వాళ్ళకి aneuploidy rates అనేవి ఎక్కువగా ఉంటాయి, అంటే abnormal embryo. So this will lead to again abortion. This will lead to implantation failure or any abnormal babies, or more prone for Down syndrome or abnormal babies. So Vilanti Wallo, somebody who is more than 40, we usually recommend to go for a PGS, that is pre-implantation genetic screening. So what is that? Usually somebody is if they're 40 and above and they're going for an IVF treatment. So then once we do an ICSI and we create the embryos, we create a blastocyst embryo. సో అట్లాంటి వాళ్ళకి మన ఎంబ్రియో ట్రాన్స్ఫర్ చేయక ముందు కూడా మనం ఆ ఎంబ్రియోని బయాప్సీ చేస్తాం. దట్ ఈస్ వీఆర్ స్క్రీనింగ్ విచ్ ఇస్ నార్మల్ ఎంబ్రియో. సో యాజ్ ఐ టోల్డ్ యూ, the number of embryos, the euploid or normal embryo which they get will be less if they're 40 and above. So in that we have to screen. If they've got 4 or 5 embryos, if we do a genetic test on them, if we do a biopsy on them and screen if they're genetically normal or not, out of this 4 or 5, we can select the best 1 or 2 embryo which is genetically normal. So ఆ ఎంబ్రియోతో వాళ్ళు ఎంబ్రియో ట్రాన్స్ఫర్ కి వెళ్తే వాళ్ళకి ఛాన్స్ ఆఫ్ ప్రెగ్నెన్సీ విల్ బి లిటిల్ హైయర్, అండ్ ఆల్సో గెటింగ్ అ ప్రెగ్నెన్సీ is faster. Instead of trying so many embryo transfers, you're selecting the best embryo, you're getting an embryo transfer done. So your chances of pregnancy will be higher and faster. So the attempts also will be lesser if you're going for such treatments. And now, one more thing is what is the risk of going? What is the risk of planning pregnancy when you're elderly? Say if you're 37 above and 40 above, they are more prone for diabetes and hypertension. Even during the pregnancy, hypertension వచ్చే రిస్క్ ఎక్కువ ఉంటుంది, షుగర్ వచ్చే రిస్క్ ఎక్కువ ఉంటుంది, అండ్ అబ్నార్మల్ కండిషన్స్, అబ్నార్మల్ మెడికల్ కండిషన్స్ ఉండే రిస్క్ ఉంటాయి, అండ్ అడ్వాన్స్ ఎల్డర్లీ ప్రెగ్నెన్సీ కింద టర్మ్ చేస్తారు, అండ్ ఆల్సో దే ఆర్ మోర్ ప్రోన్ ఫర్ సివియర్ ఇన్ఫెక్షన్. సో ముందే వాళ్ళ మెడికల్ కండిషన్స్ చూసుకొని మనం ప్రెగ్నెన్సీ ప్లాన్ చేసుకోవాలి. అండ్ ఎవ్రీథింగ్ యాజ్ ఐ టోల్డ్ యూ, స్క్రీనింగ్ ఇస్ వెరీ వెరీ ఇంపార్టెంట్ when they're planning for pregnancy at an advanced age. Now, so what problems we have when we're treating a patient with advanced age, say if they're above 35 or above 37 or 40. First thing what we notice is they will have less egg reserve. So what pre-treatment we should give? Pro IVF plan చేసుకుంటున్నారంటే వాళ్ళకి మనం ఏం pre-treatment ఇస్తాం? We will give them DHEA, if the egg reserve is less, and also we can give them antioxidants which contain ultra CoQ enzyme, which contain vitamin C and vitamin E, which can improve their egg quality. At least 1 month prior, we should prime them with antioxidants and give them proper pre-treatment, and which contains a testosterone gel if their reserve is very very less, for proper pre-treatment priming, and then we can plan for IVF next month. So always preparing their eggs and preparing their oocyte quality is very very important, and priming them 1 month prior is very important in patients with advanced age. And also we have to look into their uterus. So చాలా మంది young patients usually we need not do cavity evaluation or uterine cavity evaluation like a hysteroscopy for everybody. But some, if they are advanced age, if they are more than 35 or 37, we definitely have to look into their uterine cavity, do a hysteroscopy and uterine cavity assess చేసుకొని, if they are having any problems, if they are having any polyp or a biopsy తీసుకొని test చేసుకొని, then it is better to go ahead with embryo transfer. So even during the stimulation, so when they are planning for a stimulation, doses probably if they are advanced age or if their BMI is more, we have to plan their doses and adjust their doses accordingly. One more thing, they are more, if their patient is a diabetic, we have seen most of the patients, most of them, and not most of them, but a few of them would be diabetic when around 40 years, something like the family history is ruling on the family history, and diagnosing them is very, very important before starting any treatments. Because if you have sometimes advanced age, while once we're giving a stimulation, they might require recombinant LH, or they might require growth hormone in their stimulation. So if you're giving growth hormone for such patients, probably the sugar levels might be elevated. So up to our stimulation time, up to మనం sugar monitoring చేసుకొని, then we have to plan for treatment. So one more thing what we should see over here is, usually if they're having less reserve, their egg numbers are very less. So some patients, they'll have only 1 or 2 follicles when they're planning for their treatment, because it's become very late for them. They've come after 37 and 40 years old, and they have only 2 or 3 follicles in their ovaries which are remaining. So for such people, what should we do? If, as I told you, 10 eggs వచ్చిన వాళ్ళకి probably 4 or 5 only would be normal, that is euploid and normal embryos if they are advanced age. So అట్లాంటి వాళ్ళకి, if they have only 2 or 3 follicles, so how many follicles are we getting which are, how many eggs which are going to be euploid in them, we do not know. So to get a good number of embryos and to get good number of eggs for them in such patients, we might go for a pull up. So pull up means a pooling of the eggs or pooling of the embryos. So if a patient in one stimulation, her reserve is very, very less, and she's got only 2 or 3 eggs, and especially she is 37 above, she's 40 years above. So for such patients, we recommend pull up like in a next stimulation. So ఒక stimulation lo 3 and 4 eggs వస్తే, ఆ next month next stimulation లో మళ్ళీ ఇంకొక 3 or 4 eggs మనం pull చేసుకొని, so in that creating more number of embryos, if we create more number of embryos, that is when we can give them a good chance of pregnancy. And also I recommend for all those patients with advanced age to wait for at least a day 5 blastocyst conversion, because that gives them a better pregnancy rate than a day 3 embryos. So in that pull up, in this situations where we do a pull up, we can also do a double stimulation in such patients. So double stimulation is doing a 2 stimulation in 1 menstrual cycle. So month period వచ్చినప్పుడు ఈ menstrual cycle లో ఒక stimulation చేసి, seeing the number of, see if they get 3 embryos, if they get 3 eggs and they've got only 1 embryo, then again we can continue their stimulation from day 5 of their egg pickup, and again we can retrieve more number of eggs in the same menstrual cycle, so that we're not losing time, because they're already advanced age and already there are less number of eggs there. So in that way, with a double stimulation, we can pool the eggs and then create more embryos. In this way, they can get a good chance of pregnancy. And also, if we are planning to do a embryo biopsy, that is PGS, the pre-implantation genetic screening, to screen if the embryos are euploid or not. In that cases also, we might require more number of embryos. So in this way, we should plan for pregnancy in those patients which are more than 37 years or more than 40 years old. So now, there are few patients who come to us with, they are now 40-year-old, they already have a child, or they have 2 kids and they're already tubectomized, and sterilization already అయిపోయింది, already ముందు పిల్లలు ఉన్నారు, but some reason వల్ల again, they're planning pregnancy now, and now she is 40-year-old. So what happens now? For such patients, do we recommend pre-implantation genetic screening, or should we screen their embryos? Do they also have aneuploidy embryos in them? So that is also true, and even though if they have a baby before, when maybe they had a first baby when they are 28 years old, 27 years old, and now they waited for a long time, and now they are 40 or 42-year old. Definitely in this long period of waiting, definitely it's so many years of waiting, and because of the advanced age, the number right now వాళ్ళు ఉండే egg reserve లో లేకపోతే ఫామ్ అయ్యే ఎంబ్రియోలో aneuploidy rates ఎక్కువ ఉండొచ్చు. సో అందుకే they are more prone for abortions, and also the chances of pregnancy if they are more than 37 is lesser. So to give them good chance of pregnancy, we have to recommend, we usually recommend for embryo biopsy and screening if they are more than 40-year-old, even though if they have a normal child before, because of the advanced. In this way, what are we actually doing this for? This for to reduce the attempts of their embryo transfer, because they might have good number of embryos, but we do not know which embryo is euploid and which embryo is normal in them because of the advanced age. So if we select the best, we are reducing their attempts and also giving them a best pregnancy rate in a lesser attempt in a lesser time. So that is what is the concept of screening the embryos for advanced age people. Now, so the next is some patient. We do see patients who are around 38, 39, and also around 40, 42, who have already attained menopause, అంటే already periods ఆగిపోయి వాళ్ళకి menopause stage వచ్చేసింది. సో అట్లాంటి వాళ్ళు what can we do? So డాక్టర్ మాకు periods already ఆగిపోయి menopause వచ్చేసింది నాకు. Can I get pregnant now? Because I have only one child and now I want a second baby. Or I've not conceived till now. Somehow I've delayed and now I'm 40 and I want to get pregnant now, but I've got menopause. So in such situations, what should we do? In case if they are menopausal, definitely we'll have to look into their hormones. Hormones menopausal stage లో FSH హార్మోన్ అనేది చాలా హైగా ఉంటుంది, E2 చాలా లోగా ఉండొచ్చు. అండ్ ఆల్సో వాళ్ళ ఓవరీస్ లో ఎగ్స్ అనేవి ఎగ్జాస్ట్ అయిపోయి ఎగ్ రిజర్వ్ అనేది లేకుండా ఉంటారు సమ్ టైమ్స్ అట్లాంటి వాళ్ళకి. సో అప్పుడు మనం ఏం చేయాలి ఇన్ సచ్ సిచ్యువేషన్స్? ఇన్ కేస్ ఎగ్ లో ఓవరీస్ లో అసలు ఎగ్స్ లేవు, అసలు పీరియడ్స్ కూడా ఆగిపోయి ఒక 1 year నుంచి పీరియడ్ రావట్లేదు అనే వాళ్ళకి ఎలా ప్రెగ్నెన్సీ మనం తెప్పించాలి? సో ఇన్ సచ్ కేసెస్ we have to opt for donor egg and husband sperm. So we have to go for a third party donor egg where we have to recruit a donor for them. And if the husband's sperm is all good, say he is less than 50 years old and his sperm factors are all good, we can use his sperm into a donor egg. We can do ICSI with the husband's sperm and then we can create embryos. Meanwhile, we also have to prepare her uterus because menopausal stage వచ్చేసింది అంటే యూట్రస్ సైజ్ కూడా తగ్గిపోతుంది, చిన్నగా అయిపోతుంది, బికాస్ హార్మోన్స్ అనేవి ఏమి రిలీజ్ అవ్వట్లేదు కాబట్టి ఓవరీలోంచి. So we have to give them a HRT, prepare their uterus, at least 1 or 2 months of HRT, prepare their uterus, prime their uterus, estrogen ఇచ్చి uterus ని prime చేసి ప్రెగ్నెన్సీకి రెడీగా చేసి డోనర్ ఎగ్ తో తీసుకున్న డోనర్ దగ్గర నుంచి తీసుకున్న ఎగ్ తో హస్బెండ్ స్పర్మ్ ని ఇక్సీ చేసి ఎంబ్రియోస్ క్రియేట్ చేసి రెసిపియంట్ కి యూట్రస్ లోపలికి ట్రాన్స్ఫర్ చేస్తాం. సో ఈ విధంగా somebody who's 40 and above and somebody whose reserve is not there, they have 0 eggs and they already got menopausal stage and they are menopausal since a year ane వాళ్ళకి కూడా we can help them get pregnancy in this scenario, in this such situation. So now what is the age limit? So ఎంత వరకు మనం ఈ ట్రీట్మెంట్ చేయొచ్చు? సో ఎవ్రీబడి హూ ఇస్ 45 above and all, we cannot give all this treatment. So there is an age limit where we have to stop our treatment. So somebody, a female who is more than 45 or a male who is more than 50 and above, usually IVF treatments or any fertility treatments are not done these days because ethically we have got guidelines where after 50 we cannot give any treatments, or after 45 for a lady we cannot give any fertility treatments. So this is what we need to plan. So definitely you have to try and get pregnant before you are 45, and please do not delay. If that, please try to complete the family when you're less than 35 years, because there are a lot of issues you will be facing if you are more than 37, and the pregnancy chances would be less, and there will also be a delay in the conception rate. So you need to plan, planning pregnancy early should be done for such patients. So now we have spoke about only the female. So what about the male? The males usually they are little lucky. So usually after 40 to 60 years they can ejaculate. Spermatogenesis happens every 3 months for a male, but it's not in the same scenario for a female. After they exhaust the eggs, that's it, we cannot bring back the eggs again. But for a male, as they every 3 months as they keep producing the sperm, so we definitely he can ejaculate and give the sperm. But even for a male after 45 years, usually the sperm parameters are affected, motility and morphology, even the count will be affected. And one more thing what we need to check for a male is always a DNA fragmentation index if they're above advanced age, because of the lifestyle, because of the stress factors, or because of the age also. Their sperm quality and the DNA fragmentation would be high in such patients. So checking that, correcting that, and then taking their sperm is very important for a male who is elderly and more than 40 or 50 years old. So I think they have given a small gist about all like patients about 30 or 37 years. What should we do? One more thing what we recommend, or most of them are they know about it, they're coming to us, and also they're asking for that is what is fertility preservation. See now she's only 30 years old and she's working, and then they want to plan pregnancy only after 35 or 36. What they can do is they can freeze their oocytes. So we can do a stimulation, freeze their oocytes, and when they're planning for pregnancy, we can do if they have a partner when they're freezing the oocytes, we can do the ICSI and freeze the embryos. If they do not have a partner, it is called as social freezing, where a woman can freeze her freeze her eggs And once she's married, when the sperm is available, she can, they can do ICSI, create embryos and transfer when she's ready for pregnancy. So this is also done these days. A lot of awareness is there. Many people are coming for fertility preservation and social freezing. So this can also be done. But definitely, even if they're frozen their eggs, do not delay to get pregnant, because definitely try to finish off the pregnancy when you're less than 37 years old. So I think we have few questions here. The first question is from Sunil J. Good afternoon, madam. Good afternoon, Sunil Garu. Oasis Fertility and the whole team is doing a wonderful work. Thank you very much. The next question is from Jyotish Sharath. In frozen embryo transfer in the middle of the month, the spotting was seen, then my FET was cancelled. And then ma'am told us to have to take 1 month gap, but next month it happens that like that only. What is the problem? Okay. So Jyoti garu, meeku FPT frozen embryo transfer ante meeku they're giving you HRT, that is estrogen istunnaru. Estrogen ichi manam endometrium ni prime chestunnam. So alanti time lo meeku spotting ayindi ante the reason is you are not taking the estrogen properly, or some tablet is missed or something happened. So because when you continuously taking your estrogen when you're priming the uterus, if it is taken continuously, usually it's spotting avvadu. Atla avindi ante there is some problem, there is some hormonal imbalance which have occurred, or some tablets are missed. So it is not that the next month also you will have the same problem. Usually the recurrence would not be there. But in case if it is happening like this, you should ensure if you're taking the proper tablet, you should ensure if you're not missing the tablets, and also look for your hormones like thyroid and prolactin levels also should be checked. So it does not repeat next time again if you're taking the tablets properly. I think no more questions today. Okay, so I think we have very less questions today. Okay, I think we can stop it here. So thank you very much. So I recommend everyone to please plan your pregnancies and finish your pregnancy before you're 35 years old. Later on, you might have problems with your egg quality and numbers. There's one more question from Govardhan Garu. What is the age beyond which treatments are not done for women? Women usually after 45 years treatments are not done only because we've got the recent guidelines where it says 45 is the limit. So if the woman crosses 45 years, usually fertility treatments are not done for them. The next question is from Jyoti Sarath again. No ma'am, this month happened. Then okay, so you again the next month also it happened. You're saying Jyoti usually it depends on the tablets you're taking, amma. Every month FET మధ్యలో మీకు ఈ స్పాటింగ్ అనేది జరగదు. ఒకవేళ స్పాటింగ్ అవుతుంది అంటే you would see if there's any problem, like cervix every month you will not have the same problem. If it is happening, you have to see from the cervix or the externally ఏమన్నా cervix లోంచి కానీ cervical canal లోంచి కానీ ఏమన్నా polyp అట్లాంటి ప్రాబ్లమ్స్ ఏమన్నా ఉన్నాయా, లేకపోతే యూట్రస్ లోపల ఏమన్నా పాలిప్స్ ఉన్నాయా అనేది కొంచెం రూల్ అవుట్ చేసుకోవాలి. యూ మైట్ నీడ్ speculum examination and a hysteroscopy to see if any problem, why this problem is recurring every month. Usually in an FET cycle, spotting should not happen. Next question is from Vidhu Lalita. Till what age a woman can conceive? See, women can conceive until it depends on the woman, the ovarian reserve, her medical conditions, and her hormonal levels. And definitely, they can conceive even if they are 42 or 43. Also, we have seen patients who got pregnant who are 43 and 45 or 44 also. But what is the mode of conception? So, if they have to conceive naturally, if they have to conceive with an IUI or simple treatments, definitely the age limit should be less. But once the age advances, say 37 and 40, then also they can conceive naturally, but depends on the reserve of the patient and the chances of pregnancy will be less. It is not that they cannot conceive if they are 40 or above, but the mode of pregnancy, like whether you are conceiving naturally or your egg reserve is less and you're going for a donor option, or what is the treatment, and it depends on the age and it depends on the egg reserve. So definitely, even if you're 44, you can conceive. It's not that you cannot conceive, but how to conceive, what is the treatment you should do, and it depends upon your egg reserve, your age, and your hormones. The next question is from Govardhan Lodi. Thank you, madam. Thank you, Govardhan Garu. The next question is from Vidhu Lalita again. What is the reason for secondary infertility? Okay, this is a good question, Lalita. So, reason for secondary infertility, usually we've seen many patients who have conceived naturally first time. they would have delivered by a cesarean section, and then after that they're trying for the second pregnancy, and they'll be trying for many years. So one thing what they should do is, if you have a cesarean section before and you're not conceiving in the next cycle, you're trying for a long time, you're not able to conceive, you have to check your tubal status, because many patients after cesarean section, they might, because of the additions, they can have a tubal block. సో ఒకవేళ న్యాచురల్ గా కన్సీవ్ అయ్యి సిజేరియన్ అయిన తర్వాత మళ్ళీ ప్రెగ్నెన్సీ రాకపోతే ట్యూబ్స్ ఇవాల్యుయేట్ చేయించుకోవాలి, అండ్ మీ ఎగ్ రిజర్వ్ చెక్ చేయించుకోవాలి. ప్రాబబ్లీ యూ హ్యావ్ టేకెన్ అ లాంగ్ పీరియడ్, యువర్ ఎగ్ రిజర్వ్ తగ్గుండొచ్చు. Sometimes you might have some medical conditions which have come later on with the advanced age. Then also you need to rule out diabetes, hypertension, thyroid and prolactin levels should be checked. You have to check inside the uterus. Probably you had developed any polyp, or uterus lo emana lesions or fibroids or adenomyosis would have come later on with the age. Next, one more thing, do not forget the male. Definitely husband sperm test check cheyali. ముందు నార్మల్ గా కన్సీవ్ అయ్యి 6-7 years ముందు నార్మల్ గా కన్సీవ్, ఇప్పుడు వచ్చి స్పర్మ్ చూసుకుంటే 1 million 2 million స్పర్మ్ కౌంట్స్ తో వాళ్ళు కూడా మనం చాలా మంది చూస్తున్నాం. ఇట్ క్యాన్ బి బికాస్ ఆఫ్ ద స్ట్రెస్ ఫ్యాక్టర్స్, ఇట్ క్యాన్ బి బికాస్ ఆఫ్ ద లైఫ్ స్టైల్ ఆర్ ద ఏజ్. సో డెఫినెట్లీ హస్బెండ్ స్పర్మ్ షుడ్ బి evaluated and also check for the husband DNA fragmentation index. So all these things should be checked. So all these reasons can be all these causes can be the reason for secondary infertility. So definitely you should rule out all this when you're planning for your pregnancy. Okay, so thank you, Lalita. So I think we are done with the questions. Okay, Andy, thank you very much. So we had a good session today, and I will meet you next in the next session, in the next Facebook Live again with a separate another topic. Thank you very much. Take care.